You know what's fascinating? Humanity keeps acting like we're the pinnacle of intelligence, the species that learned from its mistakes. But the truth is, our entire history is just one long compilation of people with absolute confidence making the worst possible decisions. Not hypothetically, actually. And we're about to go through 43 of the most staggering, inexplicable moments where smart people, scientists, doctors, governments, leaders, decided to do something so patently ridiculous that you'll wonder how the human race survived this long. Moment 1. In the 1920s, radium was thought to be a miracle cure. Doctors prescribed it for everything: arthritis, fatigue, sexual dysfunction. Radium was the answer. Spas sold radium water, where people soaked in radioactive pools, believing it would heal them. It didn't heal them. It poisoned them. And they knew it. The side effects were documented. They just didn't care enough to stop selling it. Moment 2. A pharmaceutical company in the 1950s decided that cigarette filters should contain asbestos. Not just in the filters. The paper, the adhesive, everything. They literally wrapped asbestos around cigarettes and handed them to people with the assurance that it would protect their health. When the dangers became known, they continued selling them anyway. Moment 3. During the same era, doctors recommended that pregnant women take thalidomide for nausea. They didn't just suggest it, they marketed it aggressively across multiple countries. Thousands of children were born with severe birth defects. This wasn't an unknown risk. Animal testing showed the problems. They approved it anyway. Moment 4. In the 1940s, a dentist decided that the solution to cavities was to apply radioactive thorium paste directly to people's teeth. The idea was that radiation would prevent decay. It prevented a lot of things. It also caused cancer, bone necrosis, and death. He kept doing it until long after the effects became impossible to ignore. Moment 5. A major cosmetics company in the 1960s developed a hair removal cream with a toxin so powerful it could burn through skin. Women used it on their legs, their underarms, and sometimes their faces. The company's response to complaints wasn't to reformulate. It was to tell women they were using it wrong. Moment 6. Lobotomies. An entire medical establishment decided that the cure for depression, anxiety, and schizophrenia was to literally puncture a person's frontal lobe with a leucotome and scramble their brain. They performed tens of thousands of these procedures. The inventor won a Nobel Prize for destroying people's minds. Moment 7. Before that, there was trepanation, the practice of drilling holes directly into living skulls to treat mental illness. This wasn't ancient history. This was happening into the 1800s. Surgeons believed that letting out the pressure would cure insanity. What it mostly did was create a lot of very traumatized people with holes in their heads. Moment 8. In the 1950s, the US government launched an experiment where they fed radioactive food to children at a school for disabled kids without telling anyone, just to see what would happen. What happened was that children got sick. The government did it anyway, for the sake of science. Moment 9. The Tuskegee syphilis experiment. From 1932 to 1972, 40 years, the US government told African American men they were being treated for syphilis when they were actually just being observed while the disease ravaged their bodies. They had penicillin available. They didn't give it to them. They wanted to see what untreated syphilis looked like as it progressed. Moment 10. Doctors in the 1920s believed that excessive masturbation caused insanity, blindness, and moral decay. Their solution was to perform circumcision without anesthesia on young boys, sometimes multiple times, to discourage the behavior. The evidence for this theory was non-existent. They did it anyway. Moment 11. In the 1800s, a surgeon became convinced that the cure for epilepsy was to remove a patient's testicles. He performed the procedure repeatedly. None of his patients were cured. Most were permanently disfigured. He continued recommending it. Moment 12. Mercury was a cure for everything from syphilis to constipation. Doctors knew it was poisonous. There's an old saying, a night with Venus, a lifetime with Mercury. They prescribed it anyway, in doses that would kill you slowly. The fact that it was poison seemed almost irrelevant to them. Moment 13. Arsenic. It was in wallpaper, clothing dye, cosmetics, and medicine. People knew it was poison. They used it anyway because it was fashionable, and they believed the small amounts wouldn't hurt. Except they did. Hundreds of people died wearing clothes that were literally trying to kill them. Moment 14. In the 1950s, a doctor decided to treat acne by injecting people with mercury. His reasoning was that the inflammation from mercury poisoning would somehow cure the acne. It didn't. It just made people very sick while also being covered in spots. Moment 15. Doctors believed that getting struck by lightning could cure everything from gout to paralysis. Some actually tried to recreate the experience with electrical devices, zapping patients in hopes of replicating the healing powers of a near-death experience. Surprisingly, this did not work. Moment 16. In Victorian times, doctors were convinced that tight corsets and restricted breathing were beneficial for women's health. The evidence was that women looked better. That was the entire medical basis. Women's organs were literally rearranged by these devices, and doctors called it progress. Moment 17. Bloodletting. For centuries, literally centuries, the medical treatment for almost everything was to drain blood out of you. Fever, bleed. Depression, bleed. Stroke, bleed. A lot. The patient would get progressively weaker and frailer, and doctors would interpret this as the sickness leaving the body, so they'd bleed them more. George Washington died because of this. Moment 18. Doctors believed that women's ovaries were responsible for almost every mental or emotional problem. The solution was to remove them. They performed hysterectomies and ovariotomies on women for minor complaints: anxiety, restlessness, rebellious behavior. Thousands of women were sterilized without their full knowledge or consent. Moment 19. In the early 1900s, eugenics was considered rigorous science. Governments passed laws to sterilize people they deemed genetically inferior. It wasn't fringe thinking, it was policy. And it wasn't just happening in one country. The United States, Sweden, Canada, and many others implemented these programs. Moment 20. Fluoroscopy was considered so useful for examining the body that doctors would use it casually, for hours without protection. Shoe stores used it to measure children's feet. No one protected the radiation exposure. People with fluoroscopy burns and radiation sickness were told they were fine. Moment 21. A doctor in the 1900s developed a theory that syphilis could be cured by deliberately infecting patients with malaria, giving them a high fever that would burn out the syphilis. He won a Nobel Prize for this idea. Yes, some patients survived this went into remission. But a lot of patients just got both diseases. And malaria, moment 22. Scientists in the early 1900s were convinced they could measure intelligence through phrenology, examining the shape of a person's skull and making sweeping conclusions about their mental capacity. This was treated as legitimate science. It was used to justify racism, discrimination, and eugenics. There was no scientific basis whatsoever. Moment 23. And it somehow got worse. Doctors believed you could diagnose mental illness by measuring eye color, hair texture, and bone structure. They performed extensive measurements on thousands of people, particularly in psychiatric institutions, using this data to prove that certain groups were mentally inferior. The data was garbage. The conclusions were fiction. Moment 24. Insulin shock therapy. Doctors would induce severe hypoglycemia in psychiatric patients, sending them into convulsions and a coma, in hopes that the shock would cure them of mental illness. It didn't. It was horrifying. And they did it repeatedly, hundreds of times per patient. Moment 25. Electroconvulsive therapy was supposed to be less brutal. They'd electrocute patients to cause seizures, believing the seizures would reset the brain. Without anesthesia, the patients would break their own bones from the force of the convulsions. This is still used today, but it was particularly brutal when they were doing it without any pain management at all. Moment 26. Doctors believed that smoking during pregnancy was actually beneficial. It would calm the mother's nerves, reduce stress, and therefore improve fetal health. They prescribed cigarettes to pregnant women. Advertisements featured pregnant women smoking with text explaining how relaxing it was for the baby. Moment 27. Cocaine was a miracle cure. It was in soft drinks. Coca-Cola still had cocaine until 1903. It was in wine, tonics, and medicines. Doctors prescribed it for depression, anxiety, and even to help with, this is not a joke, cocaine addiction. It took decades for anyone to acknowledge that maybe, possibly, cocaine was bad. Moment 28. Asbestos wasn't just used in industrial products. It was sprayed directly onto the inside of buildings for insulation. It was used in baby powder. It was in children's toys. Asbestos manufacturers knew it was poisonous. Internal documents proved it. They hid the evidence and kept selling it for decades. Moment 29. Lead was everywhere. Paint, gasoline, water pipes, children's toys. Manufacturers knew lead was poisonous. They knew it caused brain damage in children. They continued using it because removing it would be expensive. We've spent the last century dealing with an entire generation of people with lead poisoning affecting their cognition and behavior. Moment 30. The pharmaceutical industry tested new drugs on prisoners without their consent, and this was considered normal scientific practice. Prisoners were exposed to experimental medications with unknown side effects. Many suffered permanent damage. The companies and the governments involved faced no serious consequences. Moment 31. Doctors thought that women's pain during childbirth should be ignored. The pains was spiritual punishment for Eve's sin. When anesthesia was developed, the church actively opposed its use in labor. Women were told to suffer through it. This wasn't an outlier belief. It was mainstream theology influencing medicine for centuries. Moment 32. Patients with leprosy were isolated on islands, sometimes for life even after they were cured, because doctors couldn't convince themselves the disease was actually gone. Families were separated. People lived in exile for decades. The science showed they were no longer contagious. Society decided science was wrong. Moment 33. This wasn't even the worst part. Doctors were convinced that the cure for leprosy was to harvest tissue from the diseased and transplant it into healthy people, believing that controlled infection would build immunity. It didn't work. It infected healthy people with leprosy. Somehow, this seemed surprising to the medical community. Moment 34. Syphilis wasn't just left untreated in Tuskegee. Doctors in Guatemala deliberately infected prison inmates, sex workers, and psychiatric patients with syphilis to study the disease progression. The U.S. government funded it. They called it medical research. When it was discovered decades later, the government apologized but faced minimal legal consequences. Moment 35. Xenotransplantation seemed brilliant at the time. Take organs from animals and transplant them into humans. Doctors performed these surgeries despite overwhelming evidence that it wouldn't work. Some patients died immediately. Others developed bizarre complications. The practice continued because the idea was too appealing to abandon. Evidence be damned. Moment 36. Doctors were convinced that women's reproductive organs were toxic and caused autointoxication. The solution was to remove parts of the colon or install colostomies to prevent the toxins from spreading. Thousands of healthy women underwent these mutilating procedures based on a theory that had zero scientific basis. Moment 37. The British government deliberately infected mental patients with hepatitis to test the effectiveness of a potential vaccine. The patients didn't consent. Many became severely ill. The government decided this was an acceptable cost of advancing medical knowledge. Moment 38. Thioridazine was given to children in schools to keep them calm and compliant. Teachers reported better behavior. Doctors celebrated the results. No one was particularly concerned that a significant portion of the medicated children developed serious neurological problems later in life. Moment 39. Scientists became convinced that personality, criminality, and intelligence were determined by bumps on the head. This wasn't ancient history. This was the 1800s. They measured thousands of skulls. They wrote detailed studies. They testified in court using this evidence. It was all meaningless. Moment 40. The army allowed soldiers to be exposed to chemical and biological agents without their knowledge or consent, to study the effects. When the soldiers became ill, they were told they were fine. Documentation disappeared. Decades later, soldiers were still fighting for compensation while the government insisted the experiments never happened as described. Moment 41. Doctors believed that removing the ovaries would cure patients of hysteria, a condition they couldn't define and that may not have existed. Thousands of women were surgically sterilized for being emotional, anxious, or sexually autonomous. The surgery was called therapeutic. It was mutilation. Moment 42. A medical facility conducted experiments infecting patients with gonorrhea to observe disease progression. When the patients became severely ill, they provided minimal treatment. The researchers were interested in the science, not the suffering. This was government-sanctioned research in a supposedly civilized nation. Moment 43. And finally, the most ridiculous part of all this? Most of these people weren't malicious. They weren't cartoon villains. They were confident. They were respected. They had credentials and institutional backing. They looked at the evidence in front of them and made choices that seem incomprehensibly stupid to us now, and that's the real lesson. Our ancestors weren't idiots. They were exactly like us, certain they were right, absolutely convinced that science, logic, and reason were on their side, completely blind to their own massive mistakes. The difference is we can see theirs with perfect clarity, which means in 100 years, people will be making a list just like this one about us. So here's the question. What are we confident about right now that's going to seem obviously idiotic to people a century from now.